You may have heard a notification that we are recording this webinar. This will be available after a couple days. It needs some time to compile with Zoom after we complete the event tonight. But if you know of members or your family who could not see what we are doing tonight but would like to catch up, this will be available as a video on our BMWED YouTube channel later on, probably early next week once we get it loaded and posted. And we'll keep you in the loop on that. And I will inform your system division or federation officers when that happens as well, so they can point you in the right direction. One minute till we begin our event this evening. 1 minute. I have 7 p.m. Central Standard Time, and so I want to welcome you all to this evening's webinar, where we are going to talk to some of our experts in understanding our Railroad Employees National Healthcare Plan. Joining me this evening are Amber Rose and Angie Miller, and I will give them both plenty of time to introduce themselves and tell you about what they have to share about understanding our healthcare plan, our benefits, and how we can navigate and access those. Just a couple notes about this is a Zoom webinar. And so as you participate, you will not be able to turn on your camera like you might for a Zoom meeting. That's okay, because we're going to be using the screen to show presentations and other important stuff that you would be able to use later on after this event. Right now, you cannot unmute yourself, but that will change when I basically open up the virtual floor for the open Q&A we will have after our initial presentations. I keep everyone muted during the initial presentations just so we can be timely and respect everybody's time and ability to take part in those. And that way we're not going to step on each other's mics during a time where we're supposed to be presenting. During the open Q&A, I will ask that if you do have a question for Angie or Amber, that you use your features within the Zoom app itself to raise your virtual hand. You will often find that in the React feature, or depending on how it's set up, it will be a separate raise hand feature that you can use. I will call on folks who raise their hand and allow you to unmute and ask your question of Amber or Angie. And then once you're done with your question, I'll go ahead and mute you back up so we can keep the conversation moving. You can, however, also, anytime you would like, use the chat or Q&A feature on your Zoom app or your web browser. These will log the questions as well. So in case we can't get to everyone this evening with a question, if you put it there, we can take that record and then follow up with your question. I'll be sharing those questions with Amber and Angie so that we can make sure that you get the information you came here tonight to receive. Other than that, if you do have any questions or other issues, feel free to raise your virtual hand when it's time, and I will call on you to make sure that we can get you squared away. If after this event you still have issues, there are going to be some resources that we will be trying to showcase for you this evening to help you find out information about your healthcare plan. And if you have any other questions, you can always feel free to reach out to me at education@bmwe.org. But without any further ado, I want to go ahead and pass the mic to Angie Miller with United Healthcare, who has some great information to share with you all.
Thank you, Ash. Hi, everyone. My name's Angie Miller. I know I've probably met several of you out and about at meetings, but I wanted to discuss just a few topics about the healthcare today. I'm going to talk a little bit about the benefits, just an overview of the benefits. I'm going to talk about what happens when you go out on disability, so you realize how that process works. I'll also talk about the provider search. I've been getting questions about how can I see if a provider's in network, and then we'll do a little demo of the Your Track to Health website. So let me go ahead and share my screen and okay. All right.
There we go.
Okay, so let's get started. This is just the agenda, and we're going to talk first about the benefits and do an overview. Then, as I mentioned, we'll do the sickness and disability, provider search, and the Your Track to Health website. So before I talk about the actual benefits and the two medical plans that are available to you, I do get questions about who can I have for my coverage? Is it United Healthcare, Aetna, or Highmark Blue Cross Blue Shield? And depending on where you live or your zip code, the railroad that you work for, and your union, that determines who you can have as a healthcare provider or a vendor. So if you look at this map, it gives you a nice overview of how that's determined. The blue areas would be United Healthcare, red would be Aetna, and then white is just a free space, and you can have Highmark Blue Cross Blue Shield anywhere that you can have United Healthcare or Aetna. So this is just a map that shows you how that's determined. Now, this map has been around for a really long time. So they are starting to make a few little changes as far as United Healthcare and Aetna. Some people may have received a notification about that, but this just gives you a nice overview. And this just explains what I've explained to you about blue for UHC, red for Aetna, and then the white space is a free space. It also tells you who you can have as far as the MMCP, the managed care, or the CHCB, the comprehensive healthcare benefit plan. And what we'll do is when we talk about the Your Track to Health website, I'll show you how you can find out exactly who you can have by all those three criteria. So talking about the plan has been the same for a long time. There really hasn't been any changes to date for the deductibles, co-insurance, co-pays. But I wanted to go over with you just so you understand how the plan works and a few of the terms that we use. So first we talk about your deductible. The deductible is the amount that you pay up front before the plan would start to pay anything. So if you're going to have an outpatient visit, maybe you're having some lab work done, you're going into the hospital, those are services that would first go towards your deductible. The co-insurance is the percentage that's paid by the plan and the member once the deductible has been met. The out-of-pocket maximum would be the maximum amount that you pay out of your pocket. When we talk about that, it really applies to your co-insurance. So your deductibles do not apply to the out-of-pocket maximum. So it's really that co-insurance that you're looking at. And the co-payment is your fixed dollar amount that you pay for certain services. So if you're going to see your primary care physician, a specialist, or maybe go into the emergency room, those are those fixed co-payments. You will always pay a co-payment. So even if you've met your out-of-pocket maximum at some point, you would still be charged a co-payment for those office visits and those services. So the first plan we'll talk about is the Managed Medical Care Plan, the MMCP plan. And most people do have this plan. This would be the richer of the two plans. And when you look at this, you'll see the in-network and out-of-network columns. So when you look at this, you'll see that it really does benefit you to stay in network when you're using those providers. So as I mentioned, the benefits haven't changed in several years as far as the deductibles and the coinsurance and your out of pocket. So in network, it's $350 for an individual, $700 for family. Once you meet that deductible, the plan starts paying at 90%. You would be responsible for that 10% coinsurance. Once that coinsurance that you've paid out of your pocket reaches $2,000 for individual or $4,000 for family, then you would have met those services and they would be covered at 100%. When we're looking at the co-pays, it's $25 for the primary care physician and also $25 if you're going to an urgent care center. A specialist would be $40. The emergency room would be $100. That is waived if you're truly admitted. And the telemedicine copayment is $10, also the convenient care. Now, one thing that I wanted to mention when we talk about telemedicine, and this is really important, the $10 copayment for the telemedicine is if you are using Teladoc, and I'll talk a little bit about Teladoc in a minute. If you're having a virtual office visit with your primary care physician or specialist for your medical services, that is not covered under the plan. So during COVID, you wouldn't be able to go and see your doctors. You couldn't get out and see them. People weren't taking appointments. So during that public health emergency, those services were covered with your standard copayment. But once that public health emergency ended in May of last year, those services were no longer covered for your medical services. So you really want to use Teladoc for your telemedicine. Again, virtual visits with your primary care physician or specialist are not covered under the plan. You also have the CHCB plan, or the Comprehensive Healthcare Benefit, that is available. And this is a benefit that you would use really if you live somewhere where you don't have a lot of options in using different in-network medical providers. So as you can see, there's only one column. There's not an in-network and out-of-network. It's just one set benefit plan. The deductible is the same as the MMCP, so it's $350 for individual, $700 for family, but you're going to notice that the coinsurance is only covered at 80%. You would be responsible for 20%. And then when you look at your out of pocket, it's $3,000 for individual or $6,000 for family, so a little higher than under the managed care plan. Also, under the comprehensive health care benefit, there are no co-payments. So everything is going towards the deductible and then your coinsurance. So when you look at this plan, don't think that because there's not co-payments, this is a richer plan. This is really a plan for someone who doesn't have a lot of access to in-network providers. And this plan would be a better benefit than going out of network for the managed care plan. Now, sometimes we do run into an issue where maybe somebody will move and your zip code moves you from an MMCP plan to a CHCB plan. With that happens, you're going to get a notification from Railroad Enrollment Services. We will give you that information. You'll get a new identification card. So if you have, Highmark or United Healthcare, you'll get a new card explaining what's going on. But if you run into that situation and you don't want to be moved, you need to contact Railroad Enrollment Services right away and let us know with the information provided in that notification, and we can switch you back the first of the following month. So that's really important because sometimes that does happen. Okay. Also, I'm going to talk a little more about the additional benefits and resources that you have available to you under the national plan. So I did mention Teladoc. Teladoc is the telemedicine service. It's available 24/7. All of this information can be found on Your Track to Health, and it gives you the phone number on the slide, and then we have the website. Very important for Teladoc that you want to use teladoc.com, and you always want to make sure that you put /railroad in there, because if you just go to the standard Teladoc site, they'll charge you a higher copayment. So make sure you're putting the railroad plan. All of these benefits have been available for some time. You have Health Advocate that helps you navigate the healthcare system. Best Doctors is a second opinion program. Cleveland Clinic is a heart disease program with their Centers of Excellence. That's located in Cleveland, Ohio. Vital Decisions is if you're looking for advanced care planning. So if you have someone in your family that you know that is maybe looking at a terminal illness and they need to have some resources, this is a very good program. And one of the newer programs that just came out, I believe it was in May of this year, is something called Surgery Plus. Surgery Plus is for your planned musculoskeletal and surgical procedures. And this is a great program because if you're using Surgery Plus, you can use their providers and their network. They have their own network of providers. It's their own separate company, but they would be able to help you, have great results with those orthopedic scheduled services, and there's no cost share on your end. So you wouldn't be responsible for the deductible or the coinsurance. So this is a really great program. We do have the website here, the phone number, and there is information, as I mentioned, on Your Track to Health. At this point, I'm going to keep going, and then at the end, we can take all of the questions if that works for everyone. I did want to mention the care management programs are available to you. When we talk about the care management, it was formerly known as Railroad Health Link. So this is the same program that you've really always had available to you. The name was changed a couple years ago to Your Track to Health 24/7 Nurses and Health Specialists. But it is the formerly known name as HealthLink. So with this plan, it's no cost to you. Everything is confidential when you're using this, but you really have some great resources for some additional services. So if you wanted to have someone help you schedule appointments, if you needed some help understanding maybe your condition or dealing with a chronic condition, this is a great resource for you. It helps with your treatment options. There's a really great maternity program. There is a program to help with if you want to stop smoking, we can help you with that. So really look into this. The phone number is on the slide. It's 1-866 735-5685, and you would be speaking to one of the clinicians, a nurse or a health specialist that's available to you. They're all located in Atlanta, and they do a great job. But no matter who you have for your coverage, whether it's United Healthcare, Aetna, or Highmark Blue Cross Blue Shield, this is a program that really helps everyone. A new program that just came out this year is something called OnePass Select. And this is a flexible fitness program, and it really gives you a nice idea of maybe where you can go to work out. There are some virtual classes that are available to you. There's a meal delivery service. This information is also located on Your Track to Health. There is a charge for this membership. It is for anyone under the plan who's covered under the national plan. So, anybody covered under the plan. So, spouses, dependents. There's a classic version for $29 a month, all the way up to elite for $144 a month. And what this is, it gives you the option to use several different gyms in one of those different categories. So when you're looking at the classic program, those would be those gyms like Planet Fitness, Anytime Fitness. So if you go onto the website, you can scan the QR code, call the phone number. But what happens, you go to onepassselect.com. And when you click on Get Started, it's going to ask a few questions to determine where you live. And depending on that, it'll show you the gyms that you can use. This is great because I know that, a lot of our members aren't in one place all the time. Maybe you travel from place to place. So this is a really great way that you can use that gym membership, and you can use more than one if you wanted to. So we're pretty excited about that. One of the questions that I get mostly really, I get phone calls every day about somebody that maybe goes out on sickness or disability, and they go to see their doctor and they're told they don't have any insurance. And that's the worst thing that can happen. I get a lot of those phone calls. I will do anything I can to help anyone who's in that situation. But really, it kind of helps to know the process and what happens when you go out on sickness or disability. So when you're out on sickness or disability, United Healthcare, if you ever get anything from Railroad Enrollment Services, that is part of United Healthcare. And we take care of handling all of the eligibility for everyone. So even if you have Aetna or Highmark Blue Cross Blue Shield, the eligibility comes from the railroad to us. And then we send out the information to, Highmark, Aetna, Express Scripts, and then as of January 1st, Optum Rx. So we make sure that everybody has the information. When you go out on sickness or disability under the national plan, you as an eligible employee may be eligible for coverage until the end of the second calendar year following the year in which you last rendered compensated service or received vacation pay. So if you go out on sickness or disability, say this month in November, then you would be eligible for your health insurance benefits for the remaining part of 2024, 2025, and 2026. Your dependents would be eligible until the end of the next calendar year. So they get one extra year. So if you went out in November of 2024, your dependents may be eligible through the end of 2025. If anybody is covered under the Hospital Association or the Iron Road Plan, the dependents would be eligible for coverage, until the end of the next calendar year also. And I do believe with your benefits through Iron Road that eligible employees get that one additional year. Okay, so that's how much time you have available, but it's eligible for coverage. So this is really important to determine what we need to have on file and to know how everything is being reported to us. So when someone goes out on sickness or disability, Railroad Enrollment Services gets notified one of two ways. So first, the railroad may notify us that somebody's going out on sickness or disability. And when they do that, it's really considered an unconfirmed disability. They're just letting us know. When they let us know someone's going out on sickness or disability, that gives the member 4 months of extended coverage following the month that they last worked or received vacation pay. Okay. So, what happens is if you know you're going out on sickness or disability, you have that 4 months. But at the end of that 4 months, if we don't have any other documentation, your coverage could cancel or term. So the most important thing you can do is if you're going out, for any type of disability, you would want to get a proof of disability form. Have your physician complete that form and get it back to Railroad Enrollment Services. Now, if something happens and the coverage cancels, so you're one of those people that you go to the doctor and they say you don't have any insurance, and then you'll contact someone, they may contact me, and we'll get you that form. Once we get that completed form on file, we will, of course, reinstate that coverage and you won't have any lapse. But this form is very, very important. Also, if the railroad notifies us that you're out on sickness or disability, you're going to get a packet of information. It's your COBRA packet. So you'll get that COBRA notice that your coverage is going to end. In that COBRA notice, there is a proof of disability form. But I do realize that that notice is probably about 15 pages long, so it might get lost in the shuffle. You can get the form on your Track to Health, and I'll show you in a little bit how you can go ahead and do that. Another way that we get notified that somebody is being reported that they're out on sickness or disability is from the Railroad Retirement Board. If you're out on getting sickness benefits from the RRB, they will notify us also. The Railroad Retirement Board would notify us twice a month. Most railroads, when they notify us, it's once a month. So the Railroad Retirement Board would notify us that you're receiving those benefits. That would give you coverage for the following month. So if they notify us that you're receiving benefits, sickness benefits in November, that's going to give you coverage through the end of December. But if they stop notifying us that you're not receiving those benefits any longer, that you're receiving, those benefits, then your coverage could cancel after that next month. So having that proof of disability form on file is the key to keep that coverage going. Now, a valid proof of disability form has to include the employee's name and identification number, the beginning date of the disability. It has to have a diagnosis, and it also has to have an estimated return to work date. Now, on the proof of disability form, there is a question that says, is this member unable to do their regular occupation? If your physician circles yes, that will automatically give you the year +2 for the employee and the year +1 for the dependents. If the doctor or the physician circles no, then we can only extend the benefit to the either the estimated return to work date, like the end of that month, or the next appointment date. So we will extend the coverage as long as we can if they circle no. But what that means is you'll have to get a new form on file, every time you go to see the doctor if you're not permanently disabled. And of course, the proof of disability form does need to be signed. The best thing to do is to fax that proof of disability form to Railroad Enrollment Services to the number on the form. I've had people email the form to me and I can send it on. But, it's always best if you can have your doctor fax that form to Railroad Enrollment Services. So, doing a provider search can sometimes be frustrating. I know when I use my healthcare and I have to look to see if someone's in network, sometimes it can be confusing. So, the best thing to do is to contact the number on the back of the identification card. But you can go to Your Track to Health and you can find, the link to either United Healthcare, Aetna, or Highmark Blue Cross Blue Shield and do the provider search on your own. So I put together slides for each of the different healthcare vendors. And this gives you information of going into whoever you have, for your healthcare on the Your Track to Health website. So I use the information from what I have that's current. This is current as of November 2024. And I say that because I know that a lot of us change our websites on a regular basis. And so the information here is how I would go in and do a provider search on my own. And I'm not going to go into too much detail about this. I know that Ash said this will be available to everyone. So this would be a really good resource for you to use if you're looking for those in-network providers. One of the most important things that I can point out is if you have United Healthcare, Aetna, or Highmark Blue Cross Blue Shield, when you go to the list to look for the plan that you have, there's going to be more than one. So for instance, if you have United Healthcare and you're on the myuhc.com site, you're going to be looking, if you have the MMCP plan, you would be using the Choice Plus option. If you have the comprehensive health care benefit plan or the early retirement plan or another 23111 plan, you would choose the options PPO plan. When we go to Highmark Blue Cross Blue Shield, if you have Highmark for your plan, you would be picking the BCBS PPO for the managed care plan and the BCBS traditional plan if you have the comprehensive healthcare benefit plan. Okay, and for Aetna, this gives you the information. It's the Aetna Choice POS or the Open Access Plan. And if you do have Aetna, they only participate in the managed care plan. So this is a good resource. And on the bottom of each slide, it also gives you the 1-800 number for those healthcare vendors. Okay. So Ash, do you want to bring up the, do I stop sharing?
Go ahead and stop sharing and I will bring up my own screen here.
All right.
Okay, so do you see the Your Track to Health website yet? There it should be.
Okay, yes, got it. So the first thing I wanted to point out when I talked about that red, white, and blue map showing, who you can have for your benefits depending on where you live. So you would go to the benefits tab at the top, click on that. And then let me get my glasses on here because that is pretty small. And then you would click on benefits again in the next box. Yep. And then if you scroll down, it's going to say, go back up a little bit. It says not enrolled in a medical plan. And then it says to the right, click here on that link to see your options. And then this pulls up how you determine who's available to you. So under the railroad, I guess maybe whoever you want to pick. I was going to say BNSF. Of course, your union, and then whatever zip code, and then submit. And if you scroll down, this shows you who's available to you. So you have the managed care plan. I can't read it. Highmark and United Healthcare. Those
Yep.
would be your options. So just a nice way to see who's available to you. Okay, so that's one of the things I wanted to show you. I did want to also mention, if you go back up to the coverage tab at the top and to the forms, that gives you all of the forms that are available. And at the bottom of that list is that proof of disability form. Maybe we passed. Maybe it's in the middle. I know it's on there. I
There's
can't
a
see. Yes.
revocation and notice of qualifying event, application of
Yes.
coverage, application for extension of dependent benefits,
Mhm.
EFT, proof of disability is right
There
here.
it
It's about
is.
midway
Yeah.
through.
Right. And again, that's really an important form to have. I get questions all the time. I'm always available. My email is on the slide. So email is the best way to get a hold of me. But that is probably one of the questions that I get most of the time. If you go up to, I wanted to mention Surgery Plus. So if you just go to benefits, and then it's the orthopedic. I do believe they're actually changing their name. I don't know if that's come out yet. They're going to be known as, I believe, Lantern is
Mhm.
the new plan name. This is really a great benefit. I've heard Brian, he's the person who's talked about it at some of the meetings, and it really looks like it can be a really good cost saver for a lot of people who need the program. So it is for planned musculoskeletal and surgical procedures. So really, really important. Also at the top of the page, you can see that the employee contribution is going to be reduced, which is great, to $277.54. And when you look at the Your Track to Health website, come on here and look, because there's always information about what's new, what's coming up, anything that you need to know about. If you want to get information on retirement, there's a retirement tab at the top where you can get forms, information, anything that you need. So if you're looking to do a provider search, you can go to the benefits tab. And then if you click on your benefits, go to the bottom, like scroll down a little bit, and you can see, like, we can just look at, go up a little bit where it says United. Yeah. So if you go to Aetna, that's just a one to click on. And then if I get to my notes here, to look for a provider, you would go, there's going to be a link to find a doctor, and that's
Mhm.
going to take you right to the Aetna site. And then you just follow the instructions on and how to see who's in your network. So really great resources on the Your Track to Health website. And you
Well,
can get in touch with the Hartford if you're doing supplemental sickness, dental, vision, really anything you need. OptumRx has information on here. And I know Amber's going to talk about that in a minute. But really anything that you need. If you have questions, of course, I'm going to stick around for anyone who has any issues.
before I shut this down and move on in our presentation to Amber, I did get one question in our Q&A, and that
Mm-hmm.
is for our members, if they use the Your Track to Health website and they register and log in, Does
Yes.
information they put in here, does it go back to their railroad, or where does it go? What happens with it?
No, everything is really confidential. So that's really important. When you're logging in, this is your own private information. So logging into the Your Track to Health website is where you go during open enrollment. When you're picking your plan, when you're doing all of that, everything is confidential, just like the 24/7 nurses and health specialists. All of that information is confidential. We want you to be sure that you know that this isn't going back to the railroad in any way.
All right. Thank you for sharing that. And I'll
Yeah.
go ahead and close the share so we can pass the mic to Amber.
Hey, let me share my screen. Are you able to see it?
Yes, we can.
Okay. I'd like to introduce myself. My name is Amber Lee. I am one of the senior account managers for Railroad, beginning 1/1 of 25. This slide here, we're just going to go over the introduction, member benefits, and your Track to Health. So starting off with your benefits, I know that you all have ESI currently. You are switching to Optum RX. Your copay details, there's still a day supply, 1 through 21, $10 for generic, 30 for formulary brand, which is preferred drug, 60 for non-brand and non-preferred drug. Your mail order copays from 22-day supply to 90-day supplies, $10 for generic, $60 for formulary brand, and $120 for non-formulary brand. I do want to say that the benefit design is the same as what you've currently had. Next, prior authorizations. There are certain medications that need to be reviewed for prior authorizations. If you have a prior auth with ESI currently, those will transfer over to Optum Rx, so you don't have to worry about that. There's also, if you have a medication that is excluded, you should be receiving a letter in the mail, and we will talk about that also. We also have a dedicated phone number for you to call for customer service. They can answer any questions that you need. I have put it on each one of the slides, but the number is 844-368-8736. Communications and plan resources is next. So when I talked about you would get a member letter, please make sure if you do see something coming in the mail, because there is going to be a lot of information coming out to you all. You'll have your ID card. You'll have a letter if you are impacted as far as if a drug medication isn't going to be covered. We also have in place that once you come over to Optum Rx on January 1st, there is a grace period. So you have 3 months if you have an excluded medication to get that medication until you are able to speak with your doctor, and you will be lettered for that. There's also a QR code on this presentation that you guys will be getting from Ash. You can scan that and it'll get into the Optum Rx website so that you're able to look at drugs, see if you're in a network pharmacy, and see where the closest pharmacy is, get your drug pricing, all of that. The prescription cards, you should be getting those in the mail very soon. And it will just have your new information that you'll need to give to the pharmacy come January 1st. We also have it on your track to health /OptumRx.com. This is where you can go, like I said before, to talk about, or to see, not talk about, see what coverages you have, how much price of medication, things like that. So I am going to actually pull over your track to health. Are you able to see my Your Track to Health now?
We can, Amber.
All right, great. So you can get it from here, and I know they have these little spinny things right here, but if you go to this saying OptumRx, meet your new pharmacy benefit manager, you can click Learn More. Then it's going to go to this page, and it will, you can pick either active employees or retired employees. You would just click that. Then it will load into your Welcome to OptumRx. You can register for your account with us. You can find an in-network pharmacy, drug pricing and coverage tool, your prescription drug list, and here is a frequently asked questions. You can schedule a call with Optum. All you would do is click schedule a call. Then you can pick a date and time that works best for you. In the drop down, you can say you want to talk about pricing and coverage or healthcare benefits, prior authorization. Just click one of those, and then your name, date of birth, phone number, and email, and then hit save call. And then that will schedule a call with our team to give you a call back to go over whatever you need. Next, we can go to find an in-network pharmacy. You would go to find a pharmacy, then select the plan, which would be National Railroad Plan. You can search by address, pharmacy name, use your location. MPI license, which you would have to know that from your pharmacy. You can also, I think you had a 68516 zip code. I seen you put that on the screen earlier. This will tell you 61 results within 10 miles. It also say learn about the Optum home delivery system. So you have Walgreens that are close, and I will give you a general direction of if you need to find a pharmacy that's in network. Next, we can look at drug pricing and coverage. You can select your plan at the drop down, just national. You can add city, state, and zip, or you can use your location for that. Then you'll pick your drug name. Say you're on a blood pressure medication named lisinopril. You can actually type in lisinopril, select lisinopril, then hit search. When you're on this, you can select at the top the strength, if it's 5 milligrams, 10 milligrams, 20, 30, 40. I know I take a 10 milligram myself, so and it'll be one per day, or you can customize it if it's like they're doing 10 milligrams for twice a day, or either way. It will tell you the price per day. It's going to give you the best price on the page So that would be Optum Home Delivery for 90 days would be $6.07. Then Walgreens is $1.74 for 21 days. CVS is $1.74. So it gives you an estimate of what your drug costs would be. There's also this prescription drug list. You can search by name. You can see if it's covered. It's going to give you what tier it is, the generic, and then the brand name, and it would be a tier 3 non-preferred. And you can click on that. It will tell you if it needs a prior authorization, if you need step therapy, if it has a quantity limit, or it's a specialty medication. It'll tell you the therapeutic class and the subclass. So it's a very good tool to actually use if you're unsure as to what prescription, what your cost is, or if you need to know if it needs a prior authorization. The information center is, you can go to frequently asked questions, and it will be, who is OptumRx? When will I receive my new ID card? How do I sign up for an OptumRx account? How can I make transition to OptumRx easier? How can I order my medications from home delivery? Again, we have the customer service dedicated line for you all, and they're able to answer these questions also if you're not able to find out the information on the website as to where it is.
Amber, I do have a couple questions that popped up during your presentation. Is this a moment we could address some of those?
Yeah.
All right. Amanda B has asked about whether the mail order prescriptions that are currently Medco will automatically transfer over to OptumRx, or does our provider need to write a new script?
I actually have my strategic account executive on here also. Magna, do you know that answer? Sorry.
Give me just a moment. Let me make sure Magna can
Unmute.
unmute. So I'll be right with you.
Thank you. Sorry, can you just repeat the question again? I just want to make sure I'm answering the right thing.
Certainly. Yes. The question is, do our mail order prescriptions that are at Medco automatically transfer over to OptumRx, or does our provider need to write a new script?
So we will be receiving all the information that you have where you're filling the prescription for a 90-day supply. We will be getting the open, if there are any refills left, we will be receiving that over on our end. And once those refills are done, then we will need to get a new script. So if you have any new prescriptions that you're starting right now in November and you have a 3 refills or 4 refills, you will be good until at least January or February. And then you will be able to, then you will need to start getting a new prescription. So business will be as usual. You will be able to call OptumRx or go on OptumRx.com and have your prescriptions refilled. So yes, everything will be transferred over to us.
And sometimes best practice is to, if you're unsure or worried, to just go ahead and have your provider send it to OptumRx at the beginning of January. That way there is one on file also.
All right. We also have been getting questions from members asking why they cannot see all of their dependents on the Optum portal. Will that change January 1st so members can see all their dependents, or do you have any more information on that, Amber?
So you will have to, if it is a child age of 12 and over, they would have to register, and you would have to go in and give permission for the primary person to see all of their dependents. So it's set up to where each dependent has their own Optum Rx account, but you're able to go in and move it over. You just have to send a request. And I think there is, I will look and I can get back with that person on directions on how to switch that over.
Okay. And then I will post the Optum phone number in the chat. So for those who are looking for it, so you have that. And then there is another, it's a two-part question, but I wanted to make sure, is there other stuff that you want to present before we move right into the open Q&A, Amber?
That was it as
Okay.
of right now. Yes.
All right. So that being the case, for all of our participants, you're going to have to give me a little bit of grace as I set you all up to raise your hand and ask questions of Amber or Angie, because I have to do this one by one. While I'm doing that, I do know that there is a two-part question from Brother Chris Woodside in the Q&A. Amber, if you want to take a look at that while I'm doing that you may be able to help him out. And then when you do see that you have the ability to talk, I would ask that you raise your virtual hand before you just go ahead and unmute yourself. If you just go ahead and unmute yourself, I will mute you until you raise your virtual hand. So that way we can control the flow of discussion.
So Chris, your prescriptions will transfer from Express Scripts over to Optum Rx. So you will not have to have them reissue as long as they have refills. That would answer the first.
All right, we are almost there with getting everybody set up.
Many paying for this medication for multitude of reasons. Oh God.
Okay, so I see Chris Woodside, you're on. So go ahead if you wanted to follow up on the question you posted.
Okay.
Hi, Angie. This is actually Chris's wife, Carrie. The second part of the question is, we do have an adult son who is disabled on Chris's plan, who has multiple underlying medical conditions. We've attempted multiple times to get one of these weight loss prescriptions to go through, only to fail even under appeal. Is there any indication when these might start being paid for, or if ever, I guess?
So
Sorry, I was just going to say weight loss is one of the plans that is not covered. Sorry, the medication is probably not covered under your plan. Or if it is, then you will need to have a prior authorization requested from your physician. We can look at case-by-case cases and see if it's medically necessary. Our clinicians will take a look and work accordingly with the physician and see if it's possible to have the drugs covered with a prior authorization in place.
all right. Thank you, Meghna, for that clarification. I would say that if there are very, very specific questions about specific medicines you're on or specific procedures, that would be best that you use the information on the Your Track to Health website to call directly. I just want to make sure that we understand that. If you have questions about accessing these resources or the general plan information, that's really the focus of this webinar this evening.
And I also wanted to say the number that we have provided, which is dedicated just for National Railroad, the phone lines are already open. So it's open until 8 o'clock Eastern every day for now until 12:31, and it's going to be 24/7 after. So if you have any questions, you can definitely start calling from 8 o'clock Eastern in the morning, Monday to Friday. We are open and everything is loaded. They are all ready to give you any information that you're requesting right now. If you have any questions, feel free to call them.
All right. That being the case, is there anyone who wants to ask a question of Angie or Amber? Go ahead and raise your virtual hand in the Q&A and I will call on you. All right. Amanda B., I did see that you did unmute yourself earlier. Did you have a follow-up to your question or are you okay?
No, I'm okay. I got my answer. Thank you.
All right. Thanks much. All right. I see Lori Teniente. You unmuted yourself. Go ahead, sister.
Yeah, Ash, I got a question. All I got is when you sign up, it asks for your member number. Is that your BNSF number or is that your union ID number? That's what I've got members asking that. Because for me, it even asks for my ID number.
For the OptumRx
Yes.
website, yeah, there should be a drop down to where you can put in your social security number. The One Care Health ID number would be the same for OptumRx. So whatever what the One Health Care ID, that's a lot to say in one word. Once you enter that into your Track to Health to sign up for your benefits, you can use that same username and password to get into the OptumRx. But there is a drop down that you should be able to, because you don't have a member ID yet, you would just use your social security number.
Okay. And about how long does it take? Because I have my husband's on certain eye drops and I know they're going to refuse them. So how long does this take to get your cards?
You should be getting those.
Okay, soon? Okay.
Yes. Okay. Correct.
So yeah, we are actually working on those ID cards right now to be sent over to the print vendor, and you should be receiving them in the next 14 business days.
Okay, thank you.
Mm-hmm.
All right. I don't see anything active in the Q&A or the chat right now, so it's an open floor for Angie and Amber. All right. And I did put the OptumRx phone number in the chat for the Burlington System Division, so you have it there. You can find it there. Any other questions for our experts this evening? Go ahead, Spike.
Yes, good evening. My wife and I, we were looking at the OptumRx app. She was trying to make her own account. There is no drop-down box to supply Social Security number.
So on the app, the app won't be available until 1/1. You would have to do it. Yeah, you would have to do it on the actual web page on your computer.
All right, I appreciate it. Thank you.
Yeah.
It's a great question, Spike. Thank you much. All right. There is a question that got posted in the chat. If a medication for diabetes currently is covered under their current provider, will it be covered by Optum?
Yes.
So
yes. Go ahead, Magna.
Most medications for diabetes are covered, same as what you have under ESI, unless there is some brand name that there is a generic available now. where you will need to start taking the generic. That's where you will be receiving a letter in the mail with the information, and you will have a 3-month grace period for 2025 for you to fill the same prescription, but you will have the time to talk to the doctor to get a new prescription if it is not covered.
All right. Thank you, Meghna.
And sure. And talking about diabetes medications, if you are on any of the test strips that are not going to be part of the formulary, starting from 1/1, you will have 1 year. So like the monitor, the meters, I should say, and the test strips, those you will still be able to fill for 1 year. But we would prefer for you to start taking the new medications sooner rather than later. We will be sending out a letter for reminder to let you know closer to the 1 year. That's going to be probably around October of 25. We will be sending you a reminder to switch to the preferred meter that Optum prefers for members to use. But I just wanted to put that across, that you will have 1 year for the meter and the test strips for you to fill.
Another question from the chat. Will Optum Rx be able to see long-term medical history of current medications?
So every medication that is filled, they will send that over from ESI.
So we will, yeah, and that's for between 12 and 18 months time frame. Those are the medications that we will be putting in the member history. So it's not going to be going all the way to the first date that you started filling the prescription, but it will be between 12 and 18 months from today, from 1/1, where we will be putting all the information in there. And if you are filling any prescription in November or late December, we will be getting a file from ESI mid-January. That's when we will start loading all that information history also in the system on our site.
Okay. And I do have a question from Anne, but I don't want to improperly ask it. It was put in the chat. Anne, I'm going to ask you to unmute yourself and you can go ahead and ask your question directly.
Yes, I just have a question. So if currently for diabetes, if we're getting a prior authorization and it's been approved to use a drug such as Ozempic or Wegovy for treatment of a diagnosis of diabetes, not weight loss, will it still be covered then when we switch to Optum?
The PA will follow you. So if you currently have a PA on file that's still active, that PA will come over to Optum. So it will still be covered. Once that PA ends, or usually they give, I think, a year PA when they do PA reviews. So before that year's up, then you would need to redo it for a new PA.
Okay. And if the physician decides that they want to give that once without, like at the beginning of the year, if we don't have a PA currently, as long as we get a prior auth, then it would be covered.
There'll also be, if you had it prior to coming, if you've been filling prescriptions at your regular pharmacy already, so you'll have a 3-month window that you'll be able to get that medication because before the prior auth. Does that make sense?
Yes. Thank you. Yes.
All right. I had a hand raised up momentarily. Let me see if it comes back up. From Raquel Diggs. Go ahead.
Yes, I have a question.
We can hear you.
Hello.
Go ahead.
When you meet your total out-of-pocket deductible and you go to your doctor's appointments, do you still, like I personally was having therapy sessions, and originally they said I didn't have to pay because I had met my total deductible after having surgery. But like 2 months in, they started telling me that I had to pay $40 for every time I came. but they didn't understand because they didn't see where they should be billing me because it always kept telling them that I didn't. And then like when they wait 3 months, they'll get a bill saying that I owe.
Yeah, when you're the deductible and the co-insurance, that's what's going, your co-insurance is going towards your out-of-pocket maximum. So when you're looking at your benefits, you have your deductible. Once you meet your deductible and then you're paying your 10% co-insurance, that's what goes towards your out-of-pocket maximum. So if you're going to have therapy, like physical therapy, you would still be paying a copayment because that's a copay service, but it should only be the lesser copayment, typically of $25. The only exception for something like that might be if maybe you're having your physical therapy with like an orthopedic surgeon or something like that. They would charge a $40 copayment. But if you're having just regular physical therapy, it should only be a $25 copayment, but that is a copay service.
Okay. So
Yeah.
even if you reached your maximum, I had met the out of pocket. I had
Yes.
met the maximum out of pocket, and then I do understand that what you said about paying it, but no, I was charged at the $40 rate, and it was physical therapist for I had a major back
Yeah.
surgery.
You always pay copays. So even if you've met your out-of-pocket maximum, that only applies to that co-insurance.
Sure.
So you've met that you've paid that 2,000 or, for individual, 4,000 for family, that you've met that, that's covered at 100%. But anything that's a copay service, you're always going to have copayments. But it should have probably been only a $25 copayment. Do you have United Healthcare?
Yes, I do.
Okay. If you could send me or get in touch with me, I can look into it for you, because if they've overcharged you, we can get that straightened out for you. But it would still be at least $25, maybe
Sure.
not 40.
And
But
that's
if you
workable.
want to email me, you can send it to, it's Angela, ANGELA
Just 1 minute.
_R _Miller, MILLER, at UHC.com.
I'm gonna need you to repeat that one more time. I'm ready.
Sure. It is Angela, ANGELA
Okay.
_R _Miller, MILLER, at UHC.com. And my email address is also on the first slide of my presentation. So
Okay.
you can have it there, but please email me and we'll look into it and find out what's happening.
And is that the same for behavior health?
It would still be a copay. The behavioral health, it does mirror the benefits for the medical benefits. The only difference, and I'm glad you actually asked that, is I mentioned at the beginning of my presentation that your virtual services, so if you're going to see your primary care physician for your medical benefits, or a specialist, they're not covered virtually. You have to use Teladoc. But for behavioral health, for those services, you can do that virtually. You can use Teladoc, or you can do virtual visits for those behavioral health.
And if you
with
do
your
that,
regular
is
doctor.
is there a copay when you do that? Because that's
Yeah,
how.
you're still going to have your copay.
Okay, got it.
Yeah.
That's another question. And the last but not least question is, when we do go, so for instance, leading up to surgery, you have all these testing. You do radiographs, you do MRIs, you do labs. So you've already got so much going towards your deductible. So when you get in and you sit down with your register to register in for surgery, and they tell you that your price for the surgery is, I'm gonna say $2,000. Well, I have already read my ELBs, and I know that that's not the real amount, but I will pay, say for instance, $600 because I know I'm going to owe you something. But most of it has been kind of paid for because I know how many MRIs, how many CT scans, how many pre-testings I've had, and previously prior to moving up. So for just an example, they didn't, how do they go about making it show that they did do these exams and showing up so it can be counted towards the deductible? Because like now I have like really overpaid my total out of pocket because they're saying I owe this, I owe that, when some of the providers didn't even put in that I paid for this much of my towards my deductible when I had to pay for a MRI or a chest x-ray or, you know, that sort of thing.
So what happens is when you're going to, and this has happened to me too, when you're going to have a service done, they have a system, the providers have systems that they can go into to see where you are towards your benefits. So it could be that you've already had other services done, but maybe those providers haven't submitted the claims yet or something like that. And they're going to see what you have left towards your, you know, your out of pocket. What I've done is I will say to them, well, I've been having other services. I don't think that's right. Can you bill the insurance first? And then, you know, once we get that processed, then I can see what I actually owe you. A lot of times they'll work with you. You know, and they'll say, oh, okay, well, you know, we'll submit it. If you ever think that you've overpaid, you know, if you've gone over your out of pocket, and somebody owes you money back, you should be able to get that back from that provider. So if you have, you know, a situation that you know you've overpaid, if you paid your $2,000, you know, you're out of pocket, and somebody owes you a refund, we can look into that to see, you know, where you are to your out-of-pocket maximum. And if someone's billing you too much, you know, they would owe you that refund.
Sure, and I did that. So I called United Healthcare, and I had several of the representatives to let's just go over my ELBs. And that's how I figured out that some of the providers, they are not even entering the service that I paid for because, like, say for instance, when I go into them, they'll say, how much would you like to pay? And I'll say, I'll pay half right now. And I know it goes off a first come, first served basis. So if they didn't put their claim in first, someone else did, they may go back and look and say, oh, she's already met it and we didn't even bill her. So they don't bother to even enter what I did pay them. So that's what causes me to go over and over my out of, you know, so that's where I am right now. And I'm trying to tell the other people, which is not fair to them. Because I've already met it and I have bill collecting people calling me and I'm like, no, I've already paid it. And I have like bank statements, credit card statements that I've been sending to them, and they go to a third party now. And I'm like, a third party they don't have that authority to collect from me when my business was with someone else that I've already satisfied the debt with. And so it's kind of hard if someone didn't put in where I paid them, but I have proof that I paid them.
You should always, I know when I've had that situation, it's happened to me. And when my son was on my insurance, you know, he had to have a surgery, and it was the same kind of thing where they said, you need to pay, you have $800 left towards your out of pocket. How much are you going to pay today? And I said, I'm not going to pay anything today. I'm going to wait until, you know, you submit the claim, because
Right.
there are other things coming in.
Right.
And then once we see what the negotiated rate is and what I owe, then you can send me a bill. Were
Exactly.
they not willing to work with you?
Yeah, most of them will. Like, say for
Yes.
instance, when I did my surgery, they told me I owed them $2,000. So I
Mhm.
agreed, okay, I'll pay $6 because I
Mhm.
know I've already paid maybe $1,000, you know.
Right.
So okay, I'll give you $6, and I've already paid $1,000 because I had all these other you know, to even
Mhm.
get to surgery. So I've known
Right.
that
Okay.
I'm already at that point. So
All right.
I was just
Yeah.
trying to see how I can collect on some of the money that's due to me. But thank
Yeah,
you.
if you, I mean, please reach out to me
I will.
and give me
Definitely.
that
Thank you.
information. I know the customer service or member services for, you know, for United
Yeah.
Healthcare, Highmark, and Aetna, they're all dedicated. And, you know, we all, you know, try to do our best.
Sure.
But I'll see what I can do if you have, you know, those examples of where you're owed money. You
Sure.
know, please let me know.
I
Yeah.
will. Thank you
Okay.
so much.
Yeah, you're
Okay.
welcome.
All right.
That's it.
So I have Ryan Doherty. Go ahead. Ryan Doherty, you raised your hand. Please unmute yourself and ask your question. All right, moving on. Are there any other questions tonight for Amber or Angie? I know we are getting close to where I will probably want to wrap it up to respect everyone's time this evening. But I think we have time for maybe one or two more questions. All right. Just a couple notes. As both Amber and Angie said, I do have copies of their presentations, which I will make available on the BMWED library. Go to bmwe.org/library to find those. When this recording is available, I will work with our communications department to put it on our YouTube channel, youtube.com/@BMWED. That'll take a few days though, so I would say look for it maybe later next week. If we don't get to it before the Thanksgiving holiday, it'll definitely be up the week after. Beyond that, I want to give some heartfelt appreciation to both Angie and Amber and Meghna, who also helped with some great information. So thank you all for the information you provide for our members and our families this evening. Do you have any final thoughts or any last points you'd like to emphasize for our members tonight?
Just thank you. Thank you for having me. Like I said, if you have any questions, please don't hesitate to reach out to our dedicated team, and look forward to working with everyone.
Thank you, Amber.
Same here. Same here. I really appreciate any opportunity to talk with everyone and give any information that's needed.
And we are looking forward to serving you all and making sure that you guys are happy with the service that you get, and give you the answers that you need ASAP.
All right. So thank you all. And thank you to all of our sisters, brothers, and our family members who joined us this evening. And if one last point for emphasis, if you have a question about your benefits under the Railroad Employees National Health and Welfare Plan, go to ytth.com, your Track to Health website, and find lots of resources, contact information, or further guidance there. That being the case, I am going to go ahead and end this recording.